Hello, everybody. Thank you so much for joining me on yet another edition of the program Your Health on Quinoxe Radio Multimedia. Another Thursday for us to discuss on health-related matters. Today, we'll be looking at the causes of infertility, but this time around, we'll be focusing on women. Infertility can be damaging social and psychological consequences such as exclusion, divorce, social stigma, and a situation that can lead to isolation and psychological distress. Although infertility affects both sexes, but most people, especially in our African context, we often attribute women to infertility. Today, we'll be breaking those taboos around this particular subject because we have an expert right here with us. But before introducing our expert, we have my co-host, Lucy Lengo, who is around. Hello, Lucy.
Hello, Immaculate. Hello to all our listeners and viewers out there.
Lucy, we have someone. There's a specialist, and I think he's the right person for this particular topic for us, right?
Exactly.
And our guest for the day, let me unveil him. He's called Dr. EMAPI Honore. He's an obstetrician-gynaecologist. It's a pleasure to have you on the program today.
Thank you. Good morning, Immaculate. Good morning, Lucy. I think.
Yeah, sure.
Good morning to all our listeners.
It's a pleasure to have you on the program for the first time.
Same to me.
Doctor, today we'll be looking at infertility. It's something that a lot, especially in our context, in African context, we often attribute women to infertility, forgetting about the men. That's why today I chose a focus for us to focus on infertility in women. What exactly does it mean what does it mean when someone says this woman is infertile?
First of all, to do a good introduction concerning the infertility in Africa. And true, most of the time they used to say that infertility will concern only women. No, it's wrong. Infertility now need to concern both of the sex, man and woman. You see that you focus the channel of today to the women.
Yeah.
Okay, we do, but I'm sure that
will be another another program where we talk about the men themselves.
It's stigmatization that should not be do. Okay. Because most of the time when there's a problems in a couple, they always say that it's a woman. And most of the time also when you do the test, you notice that woman does not have any problem, but it's the man that's most of the time of the problem. So we have many causes for concerning the infertility to the woman. You have to reactualize most of those causes, but most of the time now it's infection. So women should take care of to their private. Infection can concern the cervix, infection can concern the vagina, infection can concern uterus, fallopian tube, and ovary. That's the main cause. Now, you see that most of the time before women should give birth at 16, 18. Yes. Then she have to go to marriage early. But now, she have to go to school first. Yeah. After go to school, they have to look for a job. After looking for a job, she have to look for a husband because of a child. And the age is going up. You should notice that fertility decrease with the age. So once women will start to check for a baby, most of the time it should be late. After 30 is not a good age to look for a child. Before they have to look for a child, before 30, because at that moment the fertility decreases to the woman. There are another many factors that can cause infertility to the woman. Hormonal disorder, yes, most of the time hormonal disorder can provoke the infertility. But there also something that people call fibroid. But not all type of fibroid should induce the infertility to the woman, or what we call ovarian cysts. We should be careful because many women has ovarian cysts and they are afraid. No, it's not all the ovarian cysts can induce the infertility. It's some type of ovarian cysts. Only the doctor can say that this ovarian cysts can induce the infertility. It's another sickness that many people they don't know, but it's a real problem of infertility in Africa. It's what we call endometriosis. It's a sickness. I don't know how to describe it. It's a part of endometrium which will left like that and go and grow anywhere, fallopian tube, uterus, in all the parts in the body, and it will create an inflammation that will induce the infertility to the woman. So there are many things. I say there was also the hormonal disorder. I don't know how to describe hormonal disorder. That we say that like we know that any woman have a cycle.
Yes.
So it could be 28 days, 28, 25. But you say I don't know exactly the day of my cycle. It can be 26 this month. Next another month is 45. Another month is 66. Or the menses, flow normally it should be flow. It means that the hormone of the woman shall be destroyed, and they have to check to know what's the problem before see what they can do.
You made mention of infections. Are all the infections the same, or is a specific type of infection that can affect a woman's womb?
I want to say that all the infections are the same because the mucosal infections is cannot really drop to the woman. But bacterial infection most of the time, virus infection most of the time. Okay. I would say that any woman have to check herself once a year if there's not problem. If there's a problem, she have to come to the hospital. But any year she have to come because there are many infections that will not have sign. You would see like that, you don't know that you have something, but there's an infection and you don't know. So it can grow and affect all the part that are, I before said, cervix, uterus, and most fallopian tube. Fallopian tube is a must because it's a tube where sperm and ovule will pass before give a child. This part, it is blocked. It's really difficult. It's a very, very important problem for the woman.
And now, before we continue, we are talking about infertility in women. And if you would like to join us on today's edition, we have the following number: 670-5470-49, 670-5470-49, or 656-62-2222. I repeat, 656-62-2222 at the end. And back to you, doctor. What are some of the physical signs that could prove that a woman is suffering from infertility?
They cannot look at a woman like that and say that she cannot give birth.
Okay.
No, it's not possible.
Okay.
They cannot look at a woman like that. They have to check. They have to check to see if there's a problem. And this is the role of the doctor to see if there's a problem. When they check, you have to check all the body concerning the physiology, concerning all the head till the private head. You know that something. It always starts from the head, from the part of the data to control the hormone of a woman. So the sign is that she stayed for a long time. Most of the time we have to define like infertility as sleeping with her husband in the same room, in the same beds for about a year without pregnancy. I say without pregnancy. When it's something like that, maybe there's a problem. At that moment, women have to go to the hospital, and the doctor to check out everything.
Lucy, he's talking about a year, whereas we have heard cases of families where after 9 months, if they don't see something...
After 3 months, something.
Okay, he hasn't even given...
Exactly. When they don't see something, yes,
exactly.
There's a problem.
Exactly.
Yes. And it's very bad because... They usually put the couple to the pressure. And pressure is very, very bad.
It's on the woman especially.
Pressure on the woman. And when most of the time, even the woman, when she sees people, you say, she's looking at me and thinking that I'm pregnant. And she started pressure on herself because herself, she needs a baby. Yeah. Especially in Africa, she have to give birth to prove to the family-in-law that
she's fertile.
Yes, she's fertile. Exactly. Once something is not come, she's on stress. But we always say that you should not stress. Wait. Normally, once you stay like that, the pregnancy will come. And most of the time, people think that they will make love with their husbands during the fertilized periods and the rest of the pregnancy. No, it's not like that. Wow. It's not like that. It's not every time that you have a pregnancy. It's a thing of God. It's a mission of God. It's only you say that. Wow. That's the reason we say that you have to wait for about a year. We don't say that before say that, yes, maybe there's a problem.
We have a call on the line.
Hello?
Yes, madam.
Good afternoon. Your name and where you're calling from. Good afternoon. Your name and where you're calling from.
Good afternoon, madam. Calling from Bamenda, Mr. Babila Eric from Bamenda.
Thank you. Your question, sir.
I would just want to greet you, panelists, and to say I love your program, and would like to ask if it is a man who is in infertility. I want to please ask doctor that how can we treat this type of situation if it is a man, because I understand that happens like that, that you may not know who is the cause, neither know a man or a woman. So I want to please ask that if it is a man, how can the doctor explain, or how can how can we know that it is a man, or how can we realize that it's a man? Because in some cases it is a man who does not produce.
Okay, thank you so much for
and
participating.
Then we keep on pointing finger at the woman that she is the one.
Okay.
Thank you.
Exactly what you were saying.
Thank you so much. You're welcome.
Thank you.
And thank you for your question. We all said most of the times they have to send the woman before. Go and
Exactly.
see. Go and see. And during our check, we have to call also the man. On the first exam you have to request to the man is a spermogram. You have to check the sperm count of the man. That's the first thing you have to do. You can ask the test without a man. You ask the woman, go and ask your husband to do his sperm count. Write the paper.
Can a gynecologist do that, or just a urologist?
Gynecologist should do it, but she sent it to the laboratory. But we request the test and send to the laboratory to do it. You can prepare the results. That's the first point. And after the sperm counts, when they notice that there's a problem, they will ask man to come and send it to an urologist to go and see
for
check
checkups.
it for checkup. Yes.
Okay.
And they say it can be also infection. It can also hormonal disorder. It can be also anatomic problem to the woman, to the man.
To the man. And when should a woman begin to be worried that I cannot conceive? When? At what stage?
For 1 year?
Yes. I say
Just
after
1 year?
yes.
After a year.
After a year, there's no child. There's no pregnancy. If there's not pregnancy, yes, she has to consult.
What are some specific tests every woman needs to do in order to confirm she's fertile?
There is not a specific test. In the pharmacy, they used to send something that they call fertility tests. But really, it is this efficiency, I don't know. It's only the doctor have to check and say, this is the problem. Is it concerning? Is it an infection? Is it a hormonal disorder? Is it an anatomic problem? Is the problem coming from the cervix, coming from the uterus, coming from the fallopian tube? So you cannot say that they have to do a test to know that it is fertilized or not. Only that after a year with the husband, if there's not pregnancy, we can say that there's a problem. Was talking about infertility to the women. Now there are many kind of situations. Because of life, because it's difficult, they are married, but the man is not living in the same room with the wife. Why? Because he went to look for a life. Maybe she's in Garwa and the woman is in Douala.
Long distance
relation in Europe, United States, and they say that there's no problem. And where they will meet after 2 years, and they said there's a problem. Yes, it's a real problem because they need it. They need a child.
Yes.
But the two men and women have to be together before they said that there's a problem. I was saying that no, they're thinking that they have to make love to the husband once and they have pregnancy during the fertilized period. No, it's not like that. So they always calculate the fertilized period and ask the husband to come. But when they are surprised that there is not a pregnancy, they become to worry. No, it's not that. There's no problem. Most of the time, there's no problem. It's only that you have to stay together for a long time, for a certain time before have a chance to have a pregnancy.
But then, Doc, in this case, what's the role of the ovulation period? Because we know definitely an egg is released. So definitely it should be absurd that if an egg is released, that egg cannot be fertilized.
Many situations can change your ovulation periods. Stress, traveling, maybe having happiness, contraceptive. Happiness can induce the point of ovulation period. Now, when you talk about ovulation period, it's more complex than what you
think.
Yes,
what I think.
Yes, it's more complex.
Lucy, the mention of contraceptives.
Yeah, because we know that most girls consume most women consume contraceptives, and after the time it shifts your menstruation. If you're supposed to menstruate on the 4th, you realize either you menstruate before or after, like 2 weeks after. Is this really a problem? Can this lead to infertility too?
It depends how they do the contraception. Normally, the contraception should not affect the fertility of the woman. I say normally, if a woman is taking, for example, a pill, you have to control the cycle. You go concerning go with the cycle. So normally, when you stop the contraceptive, the fertility will
come back to normal.
Come back normally.
How often should girls take contraceptives? I'm talking about pills.
It depends.
In a year?
No. If you say that you have to take a pills, it's over the time that you need till you say that I want to give birth, I want to have a pregnancy. In Europe, they can take for about 5 years. Say, okay, I will stop, and the fertility will come normally. And because what is the action of pills? They will stop the ovulation, and the physiology will work with these pills. So when you stop the pill, the physiology will come as it was before. Only if there was a problem. That's the reason we used to do some tests before put a woman to a type of contraceptive. They don't go and take a contraceptive like that. It depends on each woman. To take a contraceptive, you have to see the doctor. He should see if this one is in accordance with your body or not.
But now, these girls that consume a lot of pills, like frequently, can't it affect their conception, like for them to conceive?
It sometimes can affect. When I say that, when they take a contraceptive, you don't know when they have to do, or they take like that. Today, do you take a contraceptive? Tomorrow, they will not take. Or you take this month. The next month, they will not take. No, you stop your cycle. So there will be a problem.
Is infertility a common problem in Cameroon? Especially, I want to get from your own angle, because you are a gynecologist and you've worked with a lot of these women. How do they feel? What's their experience? Can you share some of their experiences with us?
It is a real problem. It is a real problem. We cannot consult a day without see a woman that said, I'm coming because I cannot give birth. No, it's a real problem in our country. I want to say that I tell you what can be the problem is socialized problem, hormonal disorder, and most of the time because they have to go to school before try to give birth. That's not a problem. I repeat, the fertility decrease with the age. So when you take age, fertility decrease. It's like that. And you learn that in the secondary school that the woman have a quantity of follicle eggs that would reduce with time. So you should know that. Women should not wait after 30 before say that I'm looking for a child. But how they will do? They can't
get married to themselves.
Yeah, they cannot marry themselves. That was the problem. They cannot marry themselves. I say that when it is possible, take your child, take your pregnancy, and take care of it. So it will be more calm.
But then we can get pregnant when you know you are ready, when you know you can take care of the child and all of that.
The
and
problem
I think that's
is that
one of
you cannot take a pregnancy when you are not ready. I will say that for people that are ready because you know some of women say no, I'm not ready. I don't know why you're not ready. You have a job, you have a man. You say that no, it's not that. They cannot say that I have to do all my job before give birth. No, it's like that. Even our parents,
they give birth early.
They give birth. No, they give birth early, but they have a job. Even go to farm, they carry the pregnancy and go to the farm with the pregnancy. They cannot say that I will do this one before do another one. No.
Okay. And now, what are the available treatment for infertility in our country?
Treatment options.
There are many options now in Cameroon. I've seen that. I can say that you are the top of the level concerning the treatment of infertility. Yes, it's true. It's not really common to see women that will go in Europe or in South Africa until before it was like that. But specialized, especially in Douala, they have many centers for in vitro fertilization. And now concerning the treatment, it depends what is the problem. What is the problem? So it's not all the women that they will send for fertilization center, but when they know the problem, they can treat. I tell you what can be the problem: fibroids, ovary, infection. Most of the gynecologists in Douala, in Cameroon, they can take off of women that want to give birth.
Now, if the case is infection, does it mean in vitro fertilization cannot handle such a case or something else?
No, this is only the problem of infection. When you treat the infection, there will be the pregnancy.
Okay.
Most of the time.
Great.
Yes.
Okay, so for how long can the treatment last?
It depends of the type of infection. It depends. But most of the times it will not take a long time, 3 weeks, 1 week. It depends.
Okay.
Can a woman's diet play a great role in helping her to get pregnant?
Please?
Can a woman's diet play a great role in helping her to get pregnant? Does diet play a role?
Yes,
what do you
yes.
eat?
Yes. But I will say yes, I will say no. I will not say that they have to do this or not do this.
Okay.
Normally, the conception should become naturally. It's not that because you have to eat something that you not eat again. No. But during the consultation, when you say that there's a problem, maybe because you are fat, they can say try to reduce, because fat tissue can also because of infertility. When we say that you have to reduce, you have to do sport, that to reduce, and sometimes, most of the time, the pregnancy will come. But women have to eat normally at the request to eat proteins, glycids, lipids.
Thank you so much, Dr. EMAPI Honore, for accepting my invitation.
You're welcome.
Thank you, Lucy, for being part of the program.
Always a pleasure. And
I equally want to thank our technicians, Babula Jonathan and also Bertrand Bonzini, for their technical support. From us to you over there. Thank you for listening and for watching. For those on TV, it's a pleasure always being with you. Have a wonderful evening.